So, hi, good evening, everyone. All right. So, I hope you all can hear me clearly. You all can see me very, very clearly. All right. So, I think we are live now. Okay. So, this session is specially for all our first year students, those who have recently joined the medical college. Okay. And now they are, hi, Yogesh, hi, they bought me both. Okay. So, this session is exclusive for all the entrance basically of the medical college, the medical life. First of all, I just welcome you all on behalf of DBMCI, and I am here to share a very very good news with all of you. See, all the time when you have entered the medical college, all the seniors can explain it very very well to the newcomers, that when you are in the medical college, the most difficult part is to understand and realize that now we are in the medical college. Actually, the point where everybody stops their thought process is the death, you know. And the very first year medico, when they enter the medical college, their first teacher is actually the cadaver, right? A dead body itself. So here starts the thought process of a medico, but then it takes almost 1 year to realize, it takes almost 1 year to understand that yes, we have entered the medical college. Once you go to the second year, the result comes out of the first year, then we understand, okay, now I'm going towards a path where I have to attain a degree being labeled as doctor, and I have to be responsible somehow for the society. Okay. So but then the very first year, you all know the anatomy, physiology and biochemistry, they make the very very strong foundation for all our remaining subject for the second year, third year, final year. And that is why, the base has to be very very strong, so that the building which stands on the strong base has to be a strong one and long lasting as well. All right. So now I am here to announce something very, very wonderful, something very, very amazing from the end of DBMCI for all our first year new medical students. We are coming up with the explanatory classes of all the three subjects of the first year, anatomy, physiology, and biochemistry, in which the complete content of the first year will be taught absolutely on the university guidelines, preparing you for the strongest of the base, strongest of the concept, and definitely it is going to help you out in your university exam. And this program will be run keeping in mind the duration, the timing of your colleges, and it will be absolutely a program in the evening hours. Once you are free from your college, once you are free from your own stuff, after that around 7 in the evening we are going to start the program, and we are going to give you the dedicated schedule which will tell you that complete content of all the three subjects will be covered absolutely. Okay. And then definitely you all know, your seniors can tell you very well, that all the faculties of DBMCI always have been constantly, always and always supporting all their students to do perform or well in their exam. And for the theory, now obviously the concept, the basic has to be strong, it has to be from the very first year, and the theory itself, right? So our faculties have designed a proper curriculum for you in guidelines with the NMC as well as in guidelines with the respective colleges, and according to that we are going to give you a dedicated schedule, and that schedule will be followed to complete all the three subjects of the very first year. Okay. In the one of the very common confusion that the medico has, sir, what is a need, why I need somebody else, I can read from the book. No doubt everybody can read from the book, but then definitely it takes, all the time it takes you some guidance, that what should I read first, what is going to give me the base, what is going to give me the concept, and then what is going to make my thing stronger. Okay. Now in the like a very common example, very simple example in our day-to-day life is when you have to go from point A to point B, most of us, we know the path, that okay, I'll be going to this road and that road, but still the very first act that we all do sitting in the car is first we open the Google Maps, right? That is only to give you some direction. Okay. So our university pattern classes will be based on the same thing to give you the detailing of all the three subjects, right? And to prepare you well for the university exam. All right. So clearing all your basics and all your concepts. Now, I was talking about the schedule. So we have already designed your complete schedule. We have designed the complete curriculum in guidelines with the prescribed guidelines from the NMC or from medical colleges. And according to that, per day we have divided your schedule, and every day the classes will be relayed, kind of like 5 days in a week. Okay. And today we are going to have the first class of the session, and you will be enjoying it definitely. Our faculty will be making sure that you understand all the minutest of the concept of each subject, so that once you go to the next year or to the third or the final year, all your clinical concepts are very, very strong, because your first year foundation has been very nice, right? So this is what I wanted to announce today, and I'll be personally taking care of all the content for the first year program. Okay. So we all at DBMCI will be making sure, me and my whole team will be making sure that there is nothing remaining that should be like left out, which will be like a slightest of the possibility being asked anywhere in your life, not only in the exam. Okay. So sorry. So today we are going to start with it, right? So I think my team is ready, and all the students who actually want to enjoy this program, who just want to see that how the university pattern will be followed and all the three subjects will be completed, they can very well fill the Google form which has been given in the chat section here. Just fill the form, and team will be allotting you a particular batch, and you will be able to see today's class, right? All the details of the batch, how we are going to start, what all will be the duration. We are starting basically in this month itself. Okay. And the complete detailed schedule will be covered up before your university exam, will in advance, will be covering up all your theory, will be covering up all your practical sessions, all the demonstrations which are usually done in a medical college. So we are going to bring up a complete pack, a complete 360-degree pack, whatever is required in the very first year, including your theories, the practicals, the vivas, everything. All right. So fill up the Google form if you wish to be a part of today's session, and definitely you all can connect with me in the Telegram group. Just send me a message and I'll be helping you out wherever you require, right? So DBMCA always has believed that whatever, whenever the student is connected with us, it is our responsibility now to give you the correct thing, correct direction, show you the correct path. And this is one of those things that we have brought for you to make sure that your foundations are very, very strong. All right. So I think my team has already shared. Yeah, go to the pinned message here, and you all will be able to see the very first comment in the chat section. You all can just fill that, and your number will be added to the respective group, and you'll be able to see the class. So we are going to start in just next 2 to 3 minutes only. All right. So I'll not be taking much of your time. Enjoy the class, and I'll be waiting to hear from you the feedback of the class. And trust me, you're going to just enjoy it, right? You're just going to enjoy it. It's going to be a fantastic journey with us in the very first year, right? eGurukul, most of you already have the eGurukul. Now that is a recorded platform. Again, the finest of the faculties have recorded it. But then now it is a time to enjoy, experience the live classes. And we are bringing this program absolutely on the DBMCI Live app. So you don't have to go anywhere else. Sit in your hostel rooms, enjoy the studies, and make your these foundations very, very strong. Yeah. Hi, Akarshan. Hi, Manisha. So my team has already floated the Google form. Please fill it and enjoy the class, right? So it's already 7:15. It's a time for the class, and we are just going to enjoy. All right, guys. Thank you so much for being here, and just enjoy the session. And I'm waiting to hear from all of you. All right.
Everyone, can we start? Okay. Very good evening to all. Myself, Dr. Abhirami, Physiology faculty. Very good evening to all. I think the audio video is clear. So welcome you all to this physiology session. Myself, Dr. Abhirami, the physiology faculty. So here I am to discuss important basic concepts in physiology for you. So before starting the physiology session as such, let's have a small introduction. Have you seen this program? This is a program called The Millionaire. I think you would have watched this program. So in this program, there are a series of questions. You answer the last question, you will have a chance to win. It was really interesting. There are some lifelines in the program. Like you can call a friend and you can ask the answer, or you can choose for removing 2 options out of the 4 options. So there are some lifelines like this. But this man, he did not use any of the options till his last question. In his last question, he said, I want to use an option. He wanted to call his father. He called his father. It's a live program telecasted all over the world. People are watching. And on the call, he is telling to his father, I did not call you to ask the answer for any question. I just wanted to tell you that I'm going to win $1 million in the next question. If I answer the next question, I'm going to win $1 million. He kept the phone, he gave the right answer, and he won $1 million. See what a moment this is. This much of self-confidence, even without knowing whether it is the right answer or not, he is saying, I'm going to win $1 million in the next question. How will you get this much of self-confidence? When you go for your exams, the one thing that is always lacking is self-confidence. How will you gain this self-confidence? Usually, where will you search for self-confidence? Maybe in a WhatsApp video or a Insta Reels, where somebody will be climbing a mountain, there's some music. We keep on searching for self-confidence outside. But what is that self-confidence? Clarity in the subject. You have enough clarity in the subject. You learn all the subject, and if you give the right answer, automatically that gives you the confidence for the other questions. So don't keep searching for self-confidence anywhere. Instead, sit and learn the subjects properly. Clarify the subjects. Have enough clarity in the subject. The physiology exam, when you go, you know everything in physiology. That is what is called the self-confidence. So that was about John Carpenter and how you gain self-confidence. Importance of basic subjects. Have you heard that clinical questions are being more asked? Then why should I learn physiology? So physiology is a very important basic subject. Without understanding basic concepts in physiology, you will never be able to attend questions from medicine, pathology, or pharmacology. For example, any question in medicine, let's say an ECG question, an abnormal ECG has been shown to you. How will you read that ECG without understanding the basics of ECG? which is taught in physiology. In pharmacology, if there is a question on without knowing what is insulin, how does insulin act on glucose, what are the receptors, without a knowledge of all this, which is taught in physiology, you will never be able to answer questions in pharmacology. So any clinical correlated question has a very strong physiological basis. So please understand, before you learn surgical topics, surgery related subjects, anatomy will help you. Likewise, before you learn medicine related subjects like pathology, pharmacology, medicine, pediatrics, for all these subjects, physiology will give you a strong basis. So that is why they give more importance for learning basic subjects. Once you get hold of the basic concepts, building clinical knowledge on it becomes very easier. See, what are the books of choice for learning physiology? Usually students keep asking us, which is the book of choice? There is no book of choice for physiology. Have you heard of this book called Guyton? Yes, this is a book which is like a fairy tale. You keep on reading from Guyton, you will keep on forgetting. So this is like climbing on the gate like that. Explanation of concepts, a huge book. So it's not possible to read complete Guyton. Have you heard of books like Chembulingam? So these are the books which give you a direct entry into the examination. It's long note, short note. So directly it's like opening the gate. But it's not possible for us to read all the books in physiology. As of now, one of the standardized books from which most of the questions are asked is Genong's Review of Medical Physiology. So if you ask me for one book in physiology for your entrance preparations, PG preparations, I'll say Genong. In Genong, there are few small boxes which have few clinical boxes, clinical correlations. If you get hold of the small clinical boxes in Genong, most of the questions, clinically correlated questions, you'll be able to answer. So Genong may be considered as the book of choice for physiology. Everyone has a dream. Look at that little one in the center with a bouquet in its hand. Only this one is doing smart work. There's a difference between hard work and smart work. So sit and learn everything, that is hard work. But if you know what to read, where to concentrate, how to score more marks in your exam, so that is called smart work. There's few tips to gain smart work in your preparations. High yield topics. Give more importance for high yield topics. Repeat questions are very important. Repeat questions and repeat topics are very important. If you are able to answer all the previous year questions, definitely you will be on top of the have a good knowledge of all the previous year questions. Please give more importance for previous year questions and previous year topics. So that is about the high yield topics. How will you know which is the high yield topic? All the previously asked questions and topics are high yield topics. Heb's rule. What is Heb's rule? In neurophysiology, have you learnt of Heb's rule? Synapse. Heb's rule means all the information is stored inside synapses. What is a synapse? The junction between two neurons is called as a synapse. All the information is stored inside synapse. Anatomy, physiology, or when you look at people's face, everything, whatever you read, whatever you see, all these are stored inside synapses. You can strengthen your synapse or you can weaken your synapse. That is called Heb's rule. For example, if you love someone, you always keep thinking of that person. Your brain is converting short-term memories of that person into long-term memory. So you will never forget that person. After a breakup, you are not able to forget the person because your brain has already converted short-term memories of the person into long-term memories. If you apply the same rule for your subjects, physiology, if you are able to convert short-term memories of physiology into long-term physiology, at least in your exams, you will be able to retain the concepts. That's called Heb's rule. How will you do this? Like how you keep thinking of the person again and again, revise your subjects again and again. One time you read, at least 3 times you revise your subjects. More importance you give for revision. Every time you revise, your brain is converting short-term memories into long-term memories. So physiology is being converted into a long-term memory. You will never forget the subject. So HEP's role is revision, revision, revision. Don't try to read everything one time. Instead, read less one time. Revise all that at least 3 times. Practicing a daily routine. How does practicing a daily routine help you to score well in your exams? So every day if you keep on reading, or if you want to get a good PGC, or you want to clear your exams very fast, practice questions every day. Practice MCQs. If you are in the first year, from now onwards, start practicing MCQs. Solve at least 20 questions in one day. Every day you keep doing this. By the time you reach your PG exams, almost all the subjects, all the questions you would have high probability. When you look at a question in your exam and you come for PG, already you would have seen that question anywhere in your preparation. So keep on solving questions every day. The other thing in solving questions every day, when you have a question like this, what is the answer for this question? 2024. Which is the right answer for this question? 2024. Yes, you can go. All of the options are having 20 and 24. So when you have a question like this, when you face a question like this, where you are not at all able to rule out any of the options, you should know how much time you should waste on this question. You keep on thinking of the answer for this question, never you will arrive at an answer. So in your exams, you should know which question I should give more time and which question I should not waste time on. All this comes from practicing questions every day. So please practice questions every day. That will really help you a lot. Yeah, I can see some questions. Okay, Dr. Pranav says GK Pal is good. Yes. Okay, so we'll join back. So this is about practicing questions every day. So please develop the habit of practicing questions every day, solving questions every day. Definitely it will help you. See, like this, if there is another question where you are clearly able to rule out A and B is not the answer, it should be either C or D. If two of the options you are able to rule out, then this is the question where you have to spend some time and get the right answer, because 50-50 chance of getting it right. So when you have a question where you are almost able to remove all the distractors, please spend some time and solve the question. If you are not able to rule out any of the options, don't waste time, move on to the next question. How will you assess all this? It all comes from practicing questions every day. Every day you practice questions, automatically you will be able to test your instincts. See, there is no strategy for any examination. You should fix your own strategy. So whatever is good for you comes from practice only. You keep solving questions every day, automatically you will know which strategy will work for you. So this is a small introduction to the physiology classes. So let's start with the discussion of the first topic. Then let's do nerve physiology. See, nerve physiology, it looks like a very complicated topic, but actually nerve physiology is a very interesting topic. If you are able to understand the basic concepts in nerve physiology, then building on CNS is very easier. So let's do nerve physiology. So in nerve physiology, structural and functional units of the nervous system. What are they called as? Yes, the neurons. They are called as the neurons. So what is the role of neurons? Neurons help in conduction of electrical impulses. See, when someone touches you, how are you able to feel that it is a touch sensation? Because you have a touch neuron which will carry this touch impulse to your brain, and that is telling you that it is a touch sensation. Now when someone is slapping you, now it is painful. How are you able to feel this pain? Because you have a pain neuron which is carrying this impulse into the brain, and that is telling you that it is a painful sensation. So what is the role of neurons? Neurons basically help you in transmission of electrical impulses. All the signals, the sensory signals, motor signals, all this is transmitted by the neurons. So the image that you see is a neuron. Apart from neuron, are there any other cells in the nervous system? Yes, Dr. Pranav is there. Are there any other cells in the nervous system apart from neurons? Have you heard of any other cells? Yes, they are called as the glial cells. Apart from the neurons, there are also glial cells present in the nervous system. The big cell that you see, this is a neuron. There are also other smaller cells. These are the glial cells. Just about the number of neurons and glial cells. Neurons are of the order of 10 to the power of 11 and glial cells of the order of 10 to the power of 12. Total number of synapses in your nervous system, 10 to the power of 13. So these are all few. Yes, very good, Dr. Pranav. Microglial cells, very good. See, these numbers, nowadays, more number-based questions are not asked. It is more of a concept-based question. So don't waste much time remembering numbers. Most of the questions are concept-based questions only. So just for your knowledge, these numbers, otherwise they don't have that much of significance. Very good, Dr. Pranav. Phagocytes. First, let's learn about the glial cells, the different types of glial cells. Then we do neurons. There are two types of glial cells. Microglial cell, or that's called the microglia, as you rightly said, the microglia, and macroglial cells, or the macroglia. The microglial cells, microglia, what is their function? They do phagocytosis. Microglial cells, by doing phagocytosis, what is phagocytosis? Cell eating. When a foreign body, virus or bacteria enters inside, your cells can eat them. That is called phagocytosis. By doing phagocytosis, they help in immunity, immune mechanisms. What do you call all the cells that do phagocytosis? Macrophages. They are called macrophages. So microglia are the macrophages of the nervous system. Microglia, multiple times asked question. This is about the microglial cells. What are the macroglial cells? There are three types of macroglial cells. The screen is not seen. Yes. There are three types of macroglial cells. Oligodendrocyte, Schwann cells, and astrocytes. What is the role of oligodendrocytes, Schwann cells, and astrocytes? Oligodendrocytes and Schwann cells both help in myelination. Both can form myelin. But the difference is oligodendrocytes form myelin in central nervous system and Schwann cells form myelin in peripheral nervous system. Otherwise the function is same. Both oligodendrocytes and Schwann cells both help in myelin formation. What about the astrocytes? What is the meaning of astro? Astro means star. They are star-shaped cells. Astrocytes are star-shaped cells. What is the role of astrocytes? They are very closely attached to the blood vessel that goes to the brain. Since astrocytes are very closely attached to the blood vessel that goes to the brain, they help in formation of blood-brain barriers. The other functions of astrocytes. Astrocytes can convert glutamate is converted to glutamine. So astrocytes can convert glutamate into glutamine. So these are all the important functions of astrocytes. Next we'll see what are the different type of cells which form the tissue macrophage system. The macrophages of the brain is called microglia. What are the other macrophages that are present in the body? There is a list of macrophages in the body. Let's look at this. Tissue resident macrophage means in each part of the body you have phagocytosis. Macrophage of the bone is called osteoclast. Macrophages of the lung, alveolar macrophages. Macrophages of the brain, microglia. Macrophage of the connective tissue, histiocytes. In liver, they are called Kupffer cells. On skin, Langerhans cells. On lymph nodes, sinus histiocyte. In placenta, they are called Hofpayr cells. In kidneys, intraglomerular mesangial cells. In granulomas, epithelioid cells. And in red pulp of spleen, they are called red pulp macrophages or sinusoidal lining cells. Kupffer cells, multiple times asked question, Kupffer cells. This is about the different types of tissue resident macrophages. Next, let's learn about the types of neurons. What are the different types of neurons that are present? Unipolar, bipolar, pseudo-unipolar and multipolar. Just from the term only we can understand. Unipolar means, uni means one. From the cell body, if there is one process arising, this is called a unipolar cell, a unipolar neuron. That one process is always axon. What are the examples for unipolar neurons? Invertebrates like insects, they have unipolar neurons. Bipolar. Bipolar means from the cell body there are two processes which arise. One process is the axon, the other is the dendrites. This is a bipolar. Example, bipolar cells of the retina. In the eyes, pseudo-unipolar. Pseudo means false. Pseudopodia means false appearance. Pseudo means a false appearance. It gives a false appearance as though there is one process from the cell body, but actually it is dividing into two processes. This is called a central axon and a peripheral axon. What is the central axon and the peripheral axon? The example for pseudo-unipolar cells, ganglion cells of the dorsal root. In anatomy, have you learnt about ganglion cells of the dorsal root? Or that's called the DRG, dorsal root ganglion. Let me show you a dorsal root ganglion. This is the structure of a DRG, a dorsal root ganglion. This is the DRG. In the whole nervous system, you have sensory neurons and motor neurons. From the receptors, the sensory neurons take the impulses into the spinal cord, into the dorsal root ganglion. They go through the dorsal root ganglion into the spinal cord. From spinal cord, it goes into the brain, and therefore you are able to feel the sensations. This is called the sensory part. So as you can see in this, all the sensory neurons, they move through the dorsal root ganglion into the spinal cord. This is a DRG. a dorsal root ganglion. So the importance of this dorsal root ganglion is it will have all the cell bodies inside. From these cell bodies, two processes arise. One process goes to the periphery. This is the peripheral axon, which takes the signals from the skin or the periphery, and this is the central axon, which conveys the information to the spinal cord. So you have a peripheral axon which connects to the receptor of the skin. What is the dorsal root ganglion? It has the cell bodies of these sensory neurons. See, there are two processes, peripheral axon, central axon. That's how it becomes a pseudo-unipolar neuron. So the example for pseudo-unipolar cell. See, I can say all sensory neurons are pseudo-unipolar because all sensory neurons, they go through the DRG into the spinal cord. So example for pseudo-unipolar cells, ganglion cell of dorsal root, or just I can say sensory neurons. What about multipolar cells? Multi means many. From the cell body, if there are many processes arising, this is called as a multipolar cell. From the cell body, multiple processes arising. As you can see, the longest process, axon, and other processes, dendrites. This is an example for multipolar neuron. These are the most common type of neurons in the nervous system, multipolar. Example for multipolar, motor neurons of the spinal cord. They are multipolar. What are the other variants of multipolar neurons? Pyramidal cells of hippocampus, Purkinje cell of cerebellum. These are all the other types of multipolar cells. Look at pyramidal cells of hippocampus. From the cell body, they have multiple processes arising. Purkinje cell of cerebellum. From the cell body, they also have multiple processes. Purkinje cell of cerebellum, very important question, repeatedly asked question. In Purkinje cell of cerebellum, this was a repeat histology image. This image was given, identify the cell type. How will you identify Purkinje cells? If the dendrites are dividing multiple times to form a diffuse dendritic network, then it is a Purkinje cell of cerebellum. This was an image question. So dendrites are multiple times dividing to form a diffuse dendritic connection. This is a Purkinje cell of cerebellum. Very important cells. That was about the different types of neurons. A neuron has cell body. From the cell body, multiple processes arise. They are called dendrites. Dendrites divide into spine-like structures, dendritic spines. The long process is called axon. The first part of the axon, this is called initial segment of the axon or the axon hillock. Initial segment of axon or axon hillock. On the axon, you can see a blue colored covering layer. What is that? Is myelin. In between, there are some places where there is no myelin. What is that called? Nodes of Ranvier. These are the important parts of the neuron. What is the clinical correlation for each of these? Dendrites. Dendrites are called as the receptor zone. Why they called receptor zone? Because they receive the impulses from the previous neuron. You look at this diagram. You can see two neurons. The first one is connected to the second one at this junction. You can see that the dendrite of the second neuron moves out and takes the impulse from the first neuron. So dendrites are called as the receptor zone because they are only receiving the impulse from the previous neuron. So they become the receptor zone. How do they receive the impulses? Once they receive the impulses from the previous neuron, what are these impulses? Electric potentials. These electric potentials, what is the name given for the electric potential? Yes, they are called action potentials. See, initially, they do not form action potentials. They can only form small potentials called local potentials. Initially, they form small potentials, local potential. So, what is this local potential? It's a miniature potential, small potential. These local potentials, they travel along this cell body and they reach the first part of the axon or the initial axon, the axon hillock. Once they reach the axon hillock, the local potentials are converted into action potential. They are converted to action potentials. Why? What is so special about the axon hillock? How did local potentials get converted to action potentials? The important ion for action potential is sodium. Sodium ions are very less in the dendritic spine. That is why it is not able to form an action potential. It forms a local potential. But sodium ions are rich in the axon hillock. That is why axon hillock forms action potentials. It is because of the sodium ions. How many sodium ions are there? The axon hillock. Once that was a question. The number of sodium channels present in the axon hillock. Approximately 350 to 500 sodium channels per square micrometer. Approximately 350 to 500 sodium channels per square micrometer. This is the number of sodium channels in the axon hillock. Since it is loaded with sodium channels, easily it is able to convert local potentials into action potential. What are the other significance? Myelin. What is the role of myelin? Yes, myelin helps in fast conduction. How does myelin help in fast conduction? Because myelin is an insulator. When action potential travels through the axon, it will skip the myelin. Why does it skip the myelin? Because myelin is made up of lipid and protein. There are no channels in myelin. It's only an insulator. Since it has no channels, it cannot conduct electrical impulse. So the electrical impulse skips the myelin and jumps from one node of Ranvier to the other. What is this called? Jumping conduction or saltatory conduction. This jumping conduction only is responsible for what is EEG? Electroencephalogram. The graphic recording on the sheet of paper that you get when you record the electrical activity of the brain. That is called EEG. Look at the EEG waves. EEG waves, they look like local potential waves, aren't they? See, they are very small, like miniature potentials, because EEG is the sum of local potentials that you record in the dendrites. By using electrodes, you connect over the scalp and you record the local potentials. The addition of these local potential is what is called EEG, electroencephalogram. What is the significance of myelin? Let's look at this. Yes, obviously you can see in myelinated fibers. Why the speed of conduction is fast? Because it skips the myelin, jumps from one node of Ranvier to the other. And that is the reason why myelinated fibers are faster than the unmyelinated fibers. So the first role of myelin, it helps in fast conduction. What is the other role of myelin? Myelin helps to save energy. How does myelin help to save energy? Approximately, I'll just count the number of sodium channels used at each node of Ranvier. This is not exact number, just I'm telling you. Approximately a channel is used up in every node of Ranvier. Now let me count the number of sodium channels. 1, 2, 3, 4, 5, 6, 7. Let's say 7 sodium channels were used up in a myelinated neuron. What is the fate of any sodium that enters into the cells? Whenever sodium enters into the cells, cells will never accumulate sodium. They will always try to throw out the sodium. The sodium is thrown out. Which is that channel which throws out the sodium? Sodium potassium ATPase. It means for every sodium that enters inside, one sodium potassium ATPase is broken. What is sodium potassium ATPase? ATP is broken means energy is wasted. So every time one ATP is broken, you are using up one energy. So if 7 sodium ions are entering inside, this will use up 7 energy. So in a myelinated neuron, let's say for any activity, 7 energy is used up. Now let's do this for an unmyelinated neuron. For the unmyelinated neuron, now let's count the number of sodium channels. In an unmyelinated neuron, there is no myelin. There is nothing to skip. So it has to go through all the sodium channels that are present. So if it is going through all these channels, so let's say it is going 70 ATPase, 70 energy. So 70 energy is used up. If you have myelin, you will use only 7 energy. If you lose your myelin, where you have to use only 7 energy, you are wasting 70 energy. That is why myelin helps to save energy. Myelin, fast conduction and saves energy. This is what happens to demyelinated disordered persons. Can you name any demyelination disorder? Do you know any demyelination disorders? Yes, multiple sclerosis, MS. Multiple sclerosis is a demyelination disorder. In this disease, multiple sclerosis or any demyelination disorder, the patient loses the myelin. Therefore, he is not able to do fast activities. He is not able to save energy. Even to do mild activity, he is wasting all his energy. That is about the demyelinating disorders and the importance of myelin. What is the clinical importance of myelin? Myelination is oligodendrocyte. Oligodendrocytes. Oligodendrocytes, they require a protein called myelin basic protein. Myelin basic protein. Oligodendrocytes require protein called myelin basic protein. There is a disease where you have autoantibodies against the myelin basic protein. So if there are autoantibodies for myelin basic protein, you cannot form myelin. And this is called multiple sclerosis. So what is the basic pathophysiology in multiple sclerosis? Autoantibodies against myelin basic proteins. PNS, in peripheral nervous system. Which are the cells that do myelination in peripheral nervous system? Schwann cells. And Schwann cells require a different protein. This is called protein 0 or PMP22. Peripheral myelinating protein 22. You have a disease here also. Autoantibodies against protein 0 or PMP22. What is the name of the disorder? GBS. Guillain-Barré syndrome. This is called Guillain-Barré syndrome. That's how Guillain-Barré syndrome becomes a peripheral demyelinating disease. Multiple sclerosis is a central demyelinating disease, whereas Guillain-Barré syndrome is a peripheral demyelinating disease. So there's another disorder related to the peripheral proteins. Mutations of the peripheral proteins. Charcot-Marie-Tooth disease. Mutations of these peripheral proteins. Charcot-Marie-Tooth disease. So to summarize, multiple sclerosis is a central demyelinating disease. Guillain-Barré syndrome and Charcot-Marie are peripheral demyelinating diseases. Axonal transport. Let's learn about the different types of axonal transport. How substances are transported along the axon. There are two types of transport. From the cell body to the axon terminal, like this. This is the normal direction of transport or orthodromic transport. What are the substances which go in this direction? Any substance synthesized from the cell body, like neurotransmitters, enzymes, proteins. All these substances synthesized from the cell body are taken to the axon terminal by anterograde or orthodromic transport. Which is that protein which helps in anterograde transport? Kinesin. Kinesin helps in anterograde transport. Sometimes substances go in reverse direction. From the axon terminal to the cell body in the opposite direction. Opposite or reverse means retro. So this is called retrograde transport. The protein that helps in retrograde transport, dynein. What are the substances that go in reverse direction? Example, rabies virus. If a dog bites you, suppose a dog bites you here in your hand, if your dog bites you, the rabies virus from the saliva of the dog enters into the skin, goes in the reverse direction, attacks the spinal cord and the brain. So this is retrograde transport, it's going in the opposite direction. Another example, tetanus toxin. If you have any injury, why do you take TT injections? To prevent infections from Clostridium tetanus, from tetanus toxin infection. So whenever there is an injury by a rusted particle or any iron particle which has Clostridium tetani, this enters into the skin, goes in the reverse direction, attacks your spinal cord and brain. So tetanus toxin goes in reverse direction, retrograde transport. Rabies virus was a repeat question. A case history of rabies virus was given. This is about rabies and tetanus toxin. One easy way of remembering this, look at dynein. Look at the spelling for dynein. D-Y-E-N-E-I-N. Dynein. See, when there is any rabies virus or poison entering into the body, the patient might die. So remember like this, dangerous substances, patient could die. So dynein, carried by dynein. Rabies and tetanus toxin are dangerous substances. They are carried by dynein. Let me just show you a small molecular imaging animation of how a dynein is carrying a rabies virus and it is moving along the axon. See how beautiful it is. This is called axonal transport. How kinesin and dynein are carrying the substances, and there is a term called molecular motors. What is a molecular motor? Motor means it is going to carry something. So all the substances which can carry some other substance are called molecular motors. What are all the molecular motors? Kinesin, dynein and myosin. They are collectively called as carbo. They use ATP for their energy. Carbo means it's like a courier transport. So the molecular motors are kinesin, dynein and myosin. Kinesin and dynein we saw in axonal transport. What does myosin carry? Myosin carries actin. In muscle physiology you learn this. Myosin carries actin. That is how it becomes a molecular motor. These are all the molecular motors. Before we move on to the basic structure of the nerve fibers, we'll have a small break and we'll continue. Yes, small break, 5 minutes break, and then we'll continue. Thank you. Yes, we are starting again. So we learnt about the molecular motors. Now over to basic structure of a nerve. See, these are all few terms just for your understanding. Epineurium, perineurium, endoneurium. Are these terms the same or the different? Let's have this understanding. A single axon. This yellow color structure is a single axon. The axon covered by the blue colored structure is the myelin. Every single axon along with its myelin. This is called as a nerve fiber. What is the covering layer of the nerve fiber? That red colored covering layer around the nerve fiber. This is called endoneurium. A group of nerve fibers, when they join to form, this is called a nerve bundle or a nerve fascicle. What is that green colored layer around the nerve bundle? Yes, it's called perineurium. So nerve fiber covered by endoneurium, nerve bundle or nerve fascicle is covered by perineurium. Many such nerve bundles, they join to form the nerve. Now only you call it as a nerve. Trigeminal nerve, radial nerve. So group of nerve bundles join to form the nerve. This purple colored covering layer of the nerve is called as epineurium. This is about the different covering layers of the nerve. The same terms we can also apply for the muscle. But in the muscle, instead of neurium, we use the words mycelium. So if it is a muscle, muscle fiber is covered by endomysium. Muscle fascicle is covered by perimysium. And the whole muscle is covered by epimysium. If it is a neuron, neurium. If it is the muscle, it is the mycelium. These are all few basic terms for your understanding. Cell bodies. These are all the cell bodies and the axon. A group of cell bodies. What was that? Dorsal root ganglion, from which peripheral axon, central axon arises. So DRG, dorsal root ganglion. What is a ganglion? Group of cell bodies in the peripheral nervous system. Peripheral nervous system means outside the spinal cord. See, what is central? What is at the center of the body? Brain and spinal cord in the center. So only brain and spinal cord is called central nervous system. What is peripheral nervous system? Apart from brain and spinal cord, all other nerves. In the periphery, you have muscles. The nerves supplying the muscles are called motor nerves. In the periphery, you have skin. The nerves supplying the skin are called sensory nerves. In the periphery, you have organs. Nerves supplying the organs are called autonomic nerves. So, motor nerves, sensory nerves, and autonomic nerves. These three together it is called peripheral nervous system. Brain and spinal cord, CNS. Motor nerves, sensory nerves, and autonomic nerves, PNS, peripheral nervous system. So, a group of cell bodies outside the brain and spinal cord is called ganglion. Inside the brain and spinal cord is called nucleus. The nucleus of thalamus, nucleus of hypothalamus. A group of axons. What do you call a group of axons? In the peripheral nervous system, it is called as a nerve. In the central nervous system, have you noticed this word nerve inside the brain and spinal cord? No. When you learn neuroanatomy also, we will never use the word nerve inside the brain and spinal cord. It becomes a tract. So nerve becomes a tract inside the central nervous system. So as far as it is in the periphery, it is called a nerve. When a nerve enters into the brain and spinal cord, it becomes a tract. That's why we call motor tract, sensory tract, ascending tract, descending tract. So it is called as a tract. This is about the group of cell bodies and group of axons. The terms given for this. In the eye, it is called as the optic nerve. When optic nerve enters the brain, nerve becomes tract. It is called optic tract. So in the periphery, nerve. Inside the brain and spinal cord, tract. Yes, having learned this much from the topic Introduction to Nerve Physiology, let's see if you are able to answer these questions based on this. In brain, which cell converts glutamate into glutamine? Yes, anybody for the answer? Dr. Pranav is there? Dr. Saad? Yes, it is the astrocytes. Glutamate is converted to glutamine by astrocytes. The bodies shown in the cell type. What are these bodies shown in the cell type? You can see a neuron. Inside the cell body, there are some granules. What are these granules called as? Nissl granule or tigroid bodies. They are called Nissl granules or tigroid bodies. What are these Nissl granules? There are 3 points about the Nissl granule. The 3 R points about the Nissl granules. First R. What is a Nissl granule? It is a rough endoplasmic reticulum. Secondly, it is rich in ribosome. 3. It is rich in RNA. 3 R points about Nissl granules. It is a rough endoplasmic reticulum and rich in RNA. 3 R points. So the image shows Nissl granules inside the cell body. So which is the most appropriate answer? The bodies shown in the cell type are Nissl granules. What are Nissl granules? Rough endoplasmic reticulum. So I can go with the better answer, endoplasmic reticulum. But to be very specific, rough endoplasmic reticulum. Next, let's learn about nerve injuries. First of all, tell me, can you repair a nerve? Can you repair? Partly yes and partly no. Because if a nerve is injured in the peripheral nervous system, PNS, very easily you can repair. Because peripheral nervous system has certain growth factors, nerve growth factors, which are very important for nerve regeneration. So you can easily repair peripheral nerve injuries. But CNS, regeneration is least likely because inside the brain and spinal cord, certain nerve growth factors are not present. So they can't help in regeneration. That is why we wear helmets and seat belt and you protect only the brain and spinal cord. Because brain and spinal cord is CNS. If there is any injury, you cannot regenerate. That is why we protect only the brain and spinal cord. We don't wear any seat belts or helmet for hands and legs because it is peripheral nervous system. Even if it is injured, you can very easily repair them. So PNS injuries can be regenerated. CNS injuries very difficult to repair. What about the nerve injury? This is the site of nerve injury. This portion which is close to the cell body, this is called, what do you call all the portions which are close to your body? Proximal. So this segment becomes proximal. Since proximal segment is close to the cell body will give proteins, enzymes, nerve growth factors. So it can easily go for regeneration. This is called proximal regeneration. The poor distal segment, it is far away from the cell body. There is no one to give enzymes, proteins and all. So it goes for regeneration. Regeneration. This was discovered by Waller. So it is called Wallerian degeneration. Usually, degeneration starts within 24 hours of injury, but regeneration may take up to 48 hours to start. In degeneration, what is the order of degeneration? Myelin degenerates first, followed by endoplasmic reticulum degeneration. Myelin degenerates first, followed by ER. ER is endoplasmic reticulum. And endoplasmic reticulum degeneration is called chromatolysis. Chromatolysis. What is Tinel sign? In orthopedics, there is a Tinel sign. Tinel sign means if you tap from distal to proximal over the site of injury, once you reach the proximal segment of regeneration, patient will complain of tingling sensation. If this is the site of injury, you keep tapping like this. Once you tap on the site of regeneration, patient complains of tingling sensation, and that is called Tinel sign. So it's a test used to identify the site of regeneration. Grades of nerve injury, very important question. What are the different grades of nerve injury? Nerve injury was classified by Seddon. So it is called Seddon's classification of nerve injury. How did Seddon classify nerve injuries? In the image, the first image you can see, there is no injury at all. It is a normal neuron. There is no injury. The black line that you see is myelin, covered by the blue colored layer, the axon. And over that, the black colored line that you see, this is the axon, covered by the blue colored covering layer, the myelin. And over that you can see the layers, endoneurium, epineurium. Now this is a normal neuron, perfectly normal neuron, no injury. The second one, neuropraxia. What is neuropraxia? Praxia means disturbance of conduction. The nerve is not cut. Anatomically it is not cut, but it has been compressed. So that is called neuropraxia. Compression injuries, form of compression injury. Anatomically normal, just disturbance of conduction. Example, wrist drop. What is the other name for wrist drop? Yes, Saturday night palsy. Why is it called Saturday night palsy? What happens Saturday night? Under the influence of alcohol, people lose their position and they lie upside down. If you hang yourself upside down from a table, your hands are hanging on from the table like this. In the corner of the table, axilla is compressed. So radial nerve can be compressed. Overnight, if you lie down like this on a table, axilla is getting compressed, radial nerve is getting compressed. Otherwise, this is called as honeymoon palsy. Why is it called honeymoon palsy? Newly married couples, when they lie over each other's arm throughout the night, morning they will have a numbness. That is called honeymoon palsy. This is about neuropraxia. The other form of injury, axonotmesis. This diagram is axonotmesis. See, in axonotmesis, otmesis means cut. Axonotmesis means the axon has been cut. There is injury to the axon. Sometimes also with the myelin. Axon plus myelin is cut. This is axonotmesis. Example, nerve crush injuries. This is a moderate form of injury. The worst form of injury is neurotmesis. Synaptosis means cut. Neurotmesis means the whole nerve has been. There are different types of neurotmesis based on how many layers are neurium is cut or endoneurium plus perineurium is damaged, or endo plus peri plus epi. All three layers are damaged. Based on how many layers are damaged, there are three types of neurotmesis. Damage to the endoneurium, endoneurium plus perineurium, or all the three layers. This is called Seddon's classification of nerve injury. There is another classification by Sunderland. This is called Sunderland's classification. Sunderland classification, he just inserted degrees into the Seddon's classification. Injury, axonotmesis, second degree injury, and neurotmesis, third degree. In neurotmesis there are three types. Only endoneurium is cut, third degree. Endo plus perineurium is cut, fourth degree. All three layers are cut, fifth degree. So Sunderland's classification, fifth degree is the worst form of injury. This is about the different grades of classification. Now let's see classification of nerve fibers. This is called Erlanger-Gasser classification. Very important question. Erlanger and Gasser, two people, they only discovered the classification of nerve fibers, and it's also a Nobel Prize discovery. How did they classify these nerve fibers? But first of all, why did they classify the nerve fiber? Why should you classify the nerve fiber? Why can't you have only one type of nerve fiber? Why so many types of nerve fibers? That is because you have so many functions in the body. When someone touches you, you are able to feel touch because you have a touch nerve fiber. When someone pinches you, you are able to feel pain because you have a pain fiber. When I place a tuning, how are they classified? Type A, in type A alpha, A beta, A gamma, A delta, type B and type C. This is how we classify these nerve fibers. Now what are the functions of these nerve fibers? That's what we are going to learn. Very important table in genome. Repeatedly questions are asked. So listen carefully. This is a little difficult to understand. So we'll use one easy method. I'll tell you a small comparison. First listen to that. Then we'll correlate with the functions. A small comparison. Just sit and listen. You want to buy a car. What will you do? You go to the motor company and you meet the owner. Owner is called proprietor. You go to the motor company and you meet the proprietor, the owner. He takes you to the car. What is the first thing you will do when you are near a new car? You touch the car and you press the car. Now what will you ask him? Can I go inside? You want to go inside into the car. Once you are inside, first thing that you do, switch on the AC and feel how cold it is. It's very cold. You are enjoying this chillness and you are asking them for the price of the car. You saw the name of the company, Audi company, you know the price of the car. When he is telling you the price of the car, it is so costly that it is painful for you. Now what do you decide? I don't want car and all. You call for an auto. Let me go home. So you call for an auto. There is no AC. It is very hot. Or Katrina is there. Very hot. You are returning home with a painful heart. This completes the story. Now how do we correlate this with the types of the nerve fibers? The first type of nerve fiber in Erlanger-Gasser classification, type A alpha, A beta, A gamma and A delta. The first one is A alpha. So what is the function of A alpha? Motor A alpha. Motor fiber. I can replace this proprietor by proprioception. What is proprioception? Your ability to sense position. Position sense is called proprioception. So what is the function of A alpha fibers? Motor fibers, they help in proprioception. The next one, A beta. What is the function of A beta fibers? Touch and pressure. When someone touches you, you are able to feel the touch because of A beta. When you sit on a chair, there is a pressure sensation. That is also A beta. The next type of fiber, A gamma. IN stands for intrafusal muscle fibers. What are these intrafusal muscle fibers? In the structure of any muscle, they are spindle-shaped structures inside the muscle. This yellow one is a muscle spindle. The fibers that are present outside the muscle spindle, they are called extrafusal muscle fiber. The fibers, the muscle spindle. The nerve innervation to this intrafusal fiber is A gamma. The IN stands for intrafusal muscle fibers. Nerve innervation to the intrafusal muscle fibers. The next one, A delta. What do they carry? Cold sensation, pain sensation, carried by A delta. Cold and pain. Then we have type B, auto for autonomic nerves. Auto stands for autonomic. So type B carries autonomic nerves. Type C. Type C is also autonomic, hot temperatures and also pain. So we see that two fibers in this classification, they are carrying pain. What are the two fibers that carry pain? Type A delta carries pain. C fibers also carry pain. And also two fibers carry autonomic. Type B carries autonomic. Type C also autonomic. That completes Erlanger-Gasser classification. Now let's fit this into the table. A alpha, what does it carry? Motor proprioception. A beta, yes, touch and pressure. A gamma, intrafusal muscle fiber. A delta, cold and pain. B fibers, autonomic. C is also autonomic, hot temperatures and pain. So these are the functions of the Erlanger and Gasser type of nerve fibers. The Erlanger-Gasser classification is for both motor and sensory, because you can see motor fibers and sensory fibers here. There is another classification called Lawrence classification. Lawrence classification is only for sensory, not for motor. So you include only sensory neurons. This is Lawrence classification. We'll remove the motor from this. A alpha, can I include in Lawrence? Because even though it has motor, it has proprioception. What is proprioception? Position sense. So it is sensory only. So I can include A alpha into this. So this becomes type 1. So what is type 1 Lawrence? A alpha. There are two types of proprioceptors: muscle spindle and Golgi tendon organ. Proprioceptors are of two types, muscle spindle and Golgi tendon organ. So in Lloyd's classification, the one that goes to the muscle spindle is 1A, to the Golgi tendon organ is 1B. A beta. Can I include A beta into Lloyd's? Yes, A beta is touch and pressure, sensory. So this becomes Lloyd's type 2. A gamma. What is intrafusal? It is a muscle. Muscle means it is motor. So I cannot include this into the Lloyd's classification. So this is not there. It is muscle, motor. A delta. What is cold and pain? Yes, cold and pain are sensations. So this becomes Lloyd's type 3. Type B can I include? Type B, autonomic nerves. What is autonomic innervation? To the organs inside. It is not sensory, it is to the organs. So I cannot include this one also. Type C, what is the function of type C? Autonomic, hot and pain. Although autonomic is there, hot and pain are sensations. So this becomes Lloyd's type 4. This is how we do Lloyd's classification for sensory fibers. Lloyd's type 1, 1A to the spindle, 1B to the Golgi tendon organ. A beta is type 2, A delta is type 3 and C fibers are type 4. This is how we do Lloyd's classification of sensory fibers. Few more properties of the nerve fibers. The nerve fibers type A, type B and type C. A is the king of alphabets, first alphabet. So we have to give all credits to A. A is the largest fiber, fastest fiber. Why is it fastest? Because it is myelinated fiber. A is largest, fastest, myelinated. C is last. C comes later. So exactly opposite. C is smallest, slowest and unmyelinated. B is intermediate, both size and also speed. It is in between A and C. So these are few other properties of the nerve fibers. So the importance of this is two fibers carry pain. What are the two fibers that carry pain? Pain is carried by A delta and C fiber. Why do you have two fibers for pain? Because there are two types of pain. Fast pain, slow pain. Now tell me who will carry fast pain? A is fastest. So A delta carries fast pain. C is slow. So C fibers carry slow pain. A delta fast pain, C fibers slow pain. Two fibers, they carry autonomic here. What are the two fibers that carry autonomic? Yes, type B and type C. Both carry autonomic. So how will you differentiate? What is the importance of this? B carries preganglionic autonomic fibers, whereas C fiber carries postganglionic autonomic fibers. In the arrangement of autonomic fibers, we have preganglionic neurons and postganglionic. B comes first, so it carries preganglionic. Yes. Let's finish off with few questions based on this. True about neuropraxia. What is neuropraxia? Yes, normal anatomy with just disturbance of conduction. It is a compression injury. So this normal anatomy with disturbance of conduction. This is neuropraxia. This one can you try? A person after Saturday night palsy falls asleep with one arm under the head. So you place your one arm under the head and you sleep off like that. Most of the time we do this. So you keep your hands like this, you lie on the sofa watching movie or match and you sleep off like that. Morning when you get up, you will have some numbness. What is the reason for that? You are pressurizing your arm the whole night. So A fibers are more susceptible to pressures than C fibers. See, this is about the susceptibility of the nerve fibers. What is susceptibility of the nerve fibers? A fibers are most susceptible to pressure and also local anesthesia. If you apply pressure to a group of nerve fibers, A will be first affected by the pressure. And also when you inject local anesthesia, A fibers most affected by local anesthesia. B fibers are more susceptible to hypoxia. And C fibers more susceptible to C fibers, they are actually least susceptible. They are not easily affected by any of this. They are least susceptible. This is about the susceptibility of the nerve fibers. See, how I used to remember this is, in MBBS, we are usually divided into A batch, B batch and C batch. I hope it's like that only for you also. A batch, B batch and C batch. Are you arranged alphabetically? Yes. All the names starting with A, we belong to the A batch. See, my name is Abhirami. A followed by B also. Always roll number 1. From LKG till now, wherever I go, I am roll number 1. So what are the difficulties faced by the names starting with A for A batch students? See, when they make you sit for an exam according to the alphabetical order, I will always be the first person sitting right in front of the examiner. I can't do anything. I can write only my exams. So I am always under pressure when I write an exam. But if you see C batch students, all the names starting with S, T, U, V and all, somewhere in the last row they'll be sitting. Even camera cannot capture. Happily they'll write their exams. So they are least susceptible. They don't get caught in anything. So A batch students, they are always under pressure. Even when they call you for a viva, I will be the first person entering into the viva. All those other students, they'll wait outside. They'll ask me all the questions. Easily they'll answer. So everywhere you go, A batch students are under pressure. To relieve them, please give them some local anesthesia. So A fibers, pressure and local anesthetic. C fibers, least susceptible. C batch students, happy students, they don't get caught in anything. B fibers, hypoxia. See, in between A and C batch, B batch students are suffering from lack of oxygen, hypoxia. So B fibers more susceptible to hypoxia. There's a lot of controversy about this local anesthetics, but according to anesthesia, Miller's textbook of anesthesia, A is the fiber which is more susceptible to local anesthesia. But Genome tells you it is C fiber, but since it's an anesthesia question, we go with anesthesia book, so which gives A as the answer. A is more susceptible for local anesthesia. We have come to the end of the session. For any queries you have, you can post it in the chat box. In the next class, we will continue with the other consequent topics. Happy to have joined you all for the fundamental batch session. Thank you so much. For any queries, let me know in the comment box. I'm just waiting for any questions or comments. If not, we can close the session. Thank you so much. Good night to all of you. See you in the next session.